When we look at all the engineering and medical literature that has studied the issue of facet mechanics and symptoms, we see that there is strong evidence that facet joint injury causes pain after rear-end collisions. Some new research, however, shows that there may be other injury mechanisms from low-speed crashes. Some recent studies have focused on the issues of muscle injury and spinal nerve damage. Muscle pain is an extremely common symptom after rear-end collisions, especially in the acute phase of the injury. In 1995, a study by McConnell reported that tenderness of the anterior neck muscles was one of the most common symptoms reported by their crash test volunteers. In fact, high-speed footage of these same tests showed that the test subjects' neck muscles bulged visibly during the early phases of the crash. New research by Sigmund shows that the muscles in the neck may tighten during the early part of the collision as the head begins to extend backwards. Not only may this result in a strain of the neck muscles, but it also seems to increase dramatically the amount of compression that the cervical spine experiences. As we saw earlier, this compression plays a huge role in the mechanism of injury from low-speed crashes. In short, this neck muscle reflex that is designed to protect the body actually may result in greater risk of injury. In 1986, Aldman wrote that rapid extension and flexion, like that seen in low-speed rear-end collisions, might result in rapid pressure changes in the spinal canal. This was studied by Onkren in 1996, who subjected pigs to whiplash trauma. The study discovered that there were dramatic pressure changes in the spinal canal, just as Aldman had predicted. These results were duplicated by Swedish researchers in 1999. Obviously, it is impossible to measure spinal canal pressure changes in living human occupants, but a team of Austrian scientists conducted the same type of study with human cadavers by subjecting the specimens to whiplash motion. They found that the human spine also showed dramatic pressure changes during whiplash motions, and that this pressure pulse occurred at the same time that the rapid S-shaped curve is forming in the spine. The question is, can this rapid change in pressure cause injury? Svensson et al. Was able to study this to some degree by examining the nerve tissue from the swine they used in their study. They found that while the cervical vertebral joints themselves showed no signs of injury, the ganglion of the spinal nerve shown here displayed evidence of nerve cell membrane damage. These indications of damage were most prominent in the area of C6, C8. As we saw earlier, this is the same area of the spine that is subjected to abnormal rotation. The authors of this study hypothesized that the rapid pressure changes in the spinal canal can create a great deal of strain on the spinal nerve roots, which in turn could result in pain symptoms after a low-speed crash.